All right, Joe Valenzuela here with Vista Mutual Insurance Services. Let's talk about ancillary benefits of Medicare Advantage plans and should they influence your decision on the actual plan. All right, well, first of all, you need to understand Medicare Advantage plans a little bit. Medicare Advantage plans are a type of Medicare plan. Medicare replacement takes over for your Medicare insurance and becomes the primary insurance. Now, these plans have different levels of copayments, different levels of coverage that are all different than original Medicare and different than each other. So it's important that you sit down with an expert and talk about these plans so that you can have a really good understanding. Now, when you're looking at these plans, the number one thing that you want to look at is the medical benefits, right? We don't want to buy a plan that has a great dental plan, but if I go to the hospital, I have to pay $1 million, right? So we want to first look at the medical benefits of a plan. Now, if we find a couple plans that have very similar medical benefits, then we may be able to look at the ancillary benefits to see which way pushes us to the right plan. So we never want to look solely at ancillary benefits to make our decision about a Medicare Advantage plan. And sometimes we get clients that do that. Oh, I love my plan, but I hate the dental portion. So I'm looking for a plan with dental. You don't have to change your entire plan to get one benefit that you might use a couple of times and really hurt yourself on the medical side. So first things first, look at all the medical benefits first. Your decision should be there and then on the ancillary benefits. Now, what are ancillary benefits? Well, they're supplementary services like perks or additional coverage to your primary medical coverage. Some examples of this are dental, vision, gym memberships, over-the-counter coverage, meal benefits, transportation to and from doctor's office visits. So there's a lot of different ancillary benefits, and as plans get more competitive with each other, they start to add these additional things in as an enticement. Now, they're also really good because healthcare is very reactive and it doesn't do much for you while you're well. It does a lot for you when you're sick, but these benefits are more reactive. If you have a transportation benefit, it helps you get to and from your follow-up appointments or your preventive care. If you have a gym membership, you're able to go into the gym and make yourself healthier. One of the greatest forms of preventive medicine that anything could ever give you. So they also are an incentive to help keep you healthy so that the health plan doesn't have to pay a lot of claims as well. So it's a win-win situation. These types of access to care, like dental, vision, gym memberships, are all not covered by original Medicare. So again, that's what makes these plans look so well, because they can cover benefits that are not covered under original Medicare. So when you're looking at a plan, we'll go from order of importance. You want to assess your individual health requirements and needs first, and look at the plan based on your health requirements and needs. You may not have many right now, but that can always change. This is insurance, right? So that's what it is. It's about insuring what we don't know. Okay, we want to compare the monthly premiums, the co-payments, the deductibles of the plan to ensure that you're getting a good value for what you're paying for. We also want to look at the availability, because sometimes people come to us and say, oh, I heard about this plan that has this really great dental portion. It may not be available in your area. So we want to come from a frame of reference of this is actually available for me. Let's look and compare and see what's in there. And there could be a plan that provides a bunch of ancillary benefits, but none of them are the ones that you would use. Maybe you're really interested in a vision and dental plan, and this plan offers a bunch of things like a gym membership and chiropractic and acupuncture care and meals, still giving you some value, but doesn't really cover the benefit that you're looking for. So you want to make sure that it covers the ancillary benefits that you're most interested in. And then consider how each of these things could potentially help you, even if you didn't know about them before. So if you didn't think that your plan was going to offer you a gym membership, consider that before just dismissing it. Consider, oh, well, if I go to the gym 3 times a week, I'd be much more healthy and I'll use my health plan a lot less. Or if I have a meal delivery service and I can't get to meals because I've just had a surgery or I'm recovering from an instance, it can really help me along my health. Or if it has a dental plan and I have, several things that I need to do in my mouth because it hurts me to eat, well, my nutrition is going to be much better if I'm able to get those things covered. So we want to weigh those back and forth against the actual health plan benefits. Again, you can definitely do whatever you want, but in my expertise and knowledge, you should never pick a plan solely based on the ancillary benefits. It can help you make your decision. Again, if there's very similar plans or maybe even almost the same, and this one has an ancillary benefit that you might need, consider that. Also consider the company too, right? We have a lot of insider information as agents in this industry about the companies, what their financial situation looks like. So there could be a company that's offering a very low premium and a lot of ancillary benefits that really sounds enticing to join, but they could be on the brink of bankruptcy, or they could not have good networks of doctors associated with their plans and benefits. So it's an overall picture. You can't just take the ancillaries and say, let's look at these, great dental plan, go ahead and sign me up. And this happens. We have had people that have switched plans, and it happens with agents too, but a lot in call centers where they'll call and say, hey, I'm just interested in that new dental plan that you have. And the call center will go, yep, it's a great dental plan, without really explaining all the medical benefits, and it gets somebody in a really sticky situation. Maybe they have great dental now, but they can't see the doctors that they could before, or their prescription jumped by 30 plus. So it's important that you understand the overall picture, that you pick the health plan based on your health needs, and then we look at the ancillary benefits to see specifically what you want, what you need out of your plan, and then what you would like. And that can help us make a decision. Now, ancillary benefits are incredibly important when we talk about dental and vision. Good oral health is a good indicator of overall health, and vision is a good indicator. Ocular health is a good indicator as well. So I just want to touch on one last thing here, because vision is often misconfused. What vision is there's two portions when we talk about vision. There's an ancillary portion and then there's a medical portion. Let's say that I have glaucoma or macular degeneration, a disease of my eye, a condition of my eye. Well, this is going to be covered by the medical portion of my plan. If I was just on Medicare, it'd be Medicare Part B. If I was on a Medicare Advantage plan, it'd be covered under the Medicare Part B services underneath the Medicare Advantage plan. So that is not necessarily a worry. Now, the ancillary portion of vision, that stands for your exam to get a prescription for glasses or contacts, or the materials themselves, the contacts, the lenses, or the glasses. So those are often confused. Don't confuse those. If I have glaucoma, macular degeneration, that is underneath the medical portion of my plan, goes into the medical copays, not an ancillary benefit. If I want to get some glasses and the exam for those glasses, that is the ancillary vision benefit. Now, it's, again, very important to look at this as an overall whole, and we can help you do that. Here at Vista Mutual Insurance Services, we have to go through certification programs every year to stay up to date with Medicare's changes and all the plan changes so that you don't have to. So if you're in an enrollment period and you want to make a change, we can unbiasedly guide you through that by showing you all of the health benefits as well as ancillary benefits on a plan. I'd like to thank you very much for joining me today. Hopefully you're getting a bunch of great information from these videos. Follow us everywhere: TikTok, Instagram, Facebook, LinkedIn. We're everywhere. So if you please follow us on all these channels, it helps us. If we build a bigger following and we get more views, it helps us be able to create more content for you. So thank you so much. Enjoy the rest of your day.